Good afternoon. How are you doing today?
Good, and yourself?
Good. My name is Chris. I'm a paramedic student here at the clinic.
I'm Travis. Nice to meet you.
Good to meet you, Travis. What brings you in today?
I'm getting my license done. I gotta get a physical.
Oh, okay.
I'm trying to just gotta renew my license, and I got told that I need a physical done for my EMT.
Oh, is it the class 4 license?
Yeah, class 4, yeah.
Oh, nice.
Yeah.
So you're working as an EMT right now?
Yeah, actually, I just got hired about 4 or 5 months ago, so.
Nice.
Yeah.
How's that going?
It's good. It's super stressful, but
Mhm.
I'm enjoying it, so that's always a bonus.
Good. Yeah, I remember the first few months were, they're nerve-wracking. You're
Yes.
like, I don't know what I'm doing.
Yeah, absolutely, like a
Yeah.
lost dog out there. So.
Totally get it. Totally get it. So yeah, we'll do the physical for you today.
Okay.
So what we're going to do is we're going to do the full history. We'll do a head to toe, and some of that will include needing you to remove your shirt so that I can properly assess your chest and back and abdomen. Is that okay with you?
Oh yeah, absolutely.
Good.
Yeah.
Good. If you have any questions at any point, let me know. And if there's anything that is weird or uncomfortable, just let me know and we'll make a change. Okay.
All right, sounds good.
Good.
Sweet.
Yeah. So we'll start with the history. So, are you allergic to anything at all?
No, nothing.
No foods or medications?
Nope, nothing at all that I know of. So
Good. Are you on medicine for anything?
no,
Nothing? No, any like herbal supplements or vitamins, Tylenol, aspirin, anything like that?
no, nothing like that.
And do you have a past medical history at all?
No, I'm clean. Got nothing.
Good. So no breathing problems, heart problems, seizures, diabetes,
No,
anything
none
like
of that
that?
stuff. No.
Good. And when was the last time you had something to eat?
Probably about an hour ago.
Okay. And later in the assessment, I'll be kind of pressing on your abdomen, palpating your abdomen.
Okay.
Have you gone to the washroom lately?
Yeah, just recently too. So
Good, good.
yeah.
That won't be uncomfortable for you then.
No, hopefully not.
And what were you doing before you got here?
Just relaxing at home. Nothing.
Good.
Nothing too major. So
Good, just getting ready.
yeah.
So family, we'll do a family history. Do you have a family history of any medical conditions?
No, I don't think so. Like my parents and my grandparents and all that are pretty healthy as far as I know. There's been no issues. So
Good.
yeah.
So like any heart attacks or strokes?
No, nothing.
No diabetes?
No,
Good.
none of that stuff.
Good.
Yeah.
So let's talk about a little bit of your lifestyle, kind of your day-to-day.
Okay.
We'll start with nutrition assessment. So 24-hour recall. So what have you eaten in the last 24 hours? Yeah, we'll talk food and beverage.
I've had some oatmeal, had some yogurt this morning, protein shake. I had chicken and rice for lunch.
Mm-hmm.
For dinner, I had some farmer's sausage and stuff like that. And then throughout the day, I always drink quite a bit of water. So I'd probably say, like on average, I probably drink 5 to 6 liters of water a day.
Okay, good.
So, yeah.
Good. Sounds like a pretty healthy diet.
Yeah, I like to think so, or try
Yeah.
to, right?
That's good. So on a regularly for you, how much would you say you're drinking per week? Alcohol.
Not overly much. I'd say probably only go once or twice a week, and that's only on the weekend. So
Okay.
I don't drink during the week itself usually at all. So
Okay. Has alcohol ever been a problem for you at all?
no, nothing.
No. Ever had anyone ask you if you're doing okay with it, or show any concern about your alcohol?
No, nothing
No.
like that.
Good. Any smoking?
No,
No smoking. Any drug use?
no,
Recreational or pharmaceutical?
no,
Like taking anything that's not prescribed to you?
nope.
No? Good. And so activity-wise, you said you go to the gym a lot.
Yeah.
Yeah. How active would you say you are throughout the week? Mild, moderate, or very active?
I'd say probably very active between the gym and then sports. I think I keep myself pretty occupied. So
Good. What sports do you play?
I play soccer and I play hockey as well. So
Nice.
yeah,
Good stuff.
yeah, it's fun.
Do you have what are your health goals?
My health goals.
Yeah.
That's a tough question, I guess. Just try and stay active, be somewhat fit, and
Mm-hmm.
be around a long time.
That's good.
So, yeah.
Do you have any plans on gaining weight or losing weight?
Yeah, I definitely am on a gaining weight plan right now, so I'm trying to just put on some mass.
Okay, some muscle mass?
Yeah, it's the muscle mass. Like I want to bulk up a bit and then
Yeah.
maybe cut down the road. We'll see.
Okay.
Yeah.
And yeah, so I just encourage you to do some good research on the best ways to do that. Hey, it seems
Yeah.
like you're the kind of guy that is pretty strict about what he puts in his body and cares about that kind of thing. So,
Yeah.
but yeah, just to make sure that the right stuff is going in to do that. Hey, and that it's got some scientific basis behind it.
Absolutely. Yeah.
Good. We'll talk kind of the mental health side of stuff a little bit. You said you're an EMT, and you said 4 to 5 months that you've been working.
Yeah.
Yeah.
Yeah. Probably 4.5, something like that. So.
Okay.
Yeah.
How's the stress level been?
It's been high. You know, being the new guy and new career and put in a position with quite a bit of stress. It's been high stress, but nothing that has been too overwhelming, I suppose. But definitely more stress than I've had before I had the EMT job. That's for sure.
Yeah.
Yeah.
How do you deal with stress?
I go to the gym quite a bit, sports, and then just talk to friends and hang out with family and stuff like that. So.
Good. Do you feel like you have a pretty solid support network? Around?
Oh yeah, absolutely, definitely, yeah.
Good. Good, man. Well, yeah, and just a reminder too, especially with the EMS field, there's a lot of resources around to help with, like, if you go on that crazy call that throws you off a lot, and there's the resilience program and just some other stuff that hopefully your employer has kind of shown you a little bit.
Okay.
So yeah, just to keep an eye out for that side of stuff, because sometimes it creeps up on you. Hey.
Yeah, absolutely. Yeah.
Yeah.
Okay, sweet.
Good. Well, why don't we start? We'll do your weight and we'll do your height and we'll check out what your body mass index is. So I've got a scale here for you. Get you to just stand on it. Get it ready for you there. Good. And you are 80.0 kilograms. Excellent. And just to your right, we'll measure your height. Okay. And you are at 1.80 meters. Excellent. So you can just have a seat here. So according to the math that I'm doing in my head right now,
It's talented.
I know, your body mass index is 24.7. So a normal body mass index is anywhere from 18.5 to 24.9. So you fall in that category. So
Sweet.
great job.
Awesome.
I'll check your vitals right now. Before we use the stethoscope here, I'll make sure to clean it with this cabbie wipe. Always remember to clean your stethoscope when you're working, Travis.
Absolutely.
Good. And wash hands again. Alrighty. So first, just going to check your pulse. So the most accurate way to do it would be to listen for a full minute, but we're going to do 30 seconds. So listen to your pulse for 30 seconds. Good. So I felt 32 beats, so to multiply that by 2, 64. And while I was doing that, I was also checking your respirations as well. I don't know if you could tell.
No, not at all. I
I'm
couldn't
sneaky
tell.
that way.
Yeah.
Yeah, so there was 7 in that time, so 14. Rest
Alright.
14. Heart rate is
Sweet.
64. So we'll check your blood pressure now. Alright, so let's feel first. Good. Good, so now that I can feel your brachial artery there, I know where to put the bell of my stethoscope while I take your blood pressure. Good. You're at 116 on 70 right now.
It's pretty normal for me.
Good. Good, good. Have you ever had any problems with your blood pressure?
No, nothing.
Good. And the last thing we'll do is take your temperature here. This is just going to go under your tongue. And I'll let you know when you're done. Good. 36.9 degrees Celsius. Excellent. Alright. So the next thing we're going to do is we're going to get you to look at our Snellen chart. You can stand up here and just stand at this line. So just down the hallway there, you can see there's a chart with a number of different letters on it. They're bigger at the top and get smaller as they go down. And so what I'm going to get you to do is you're going to cover one eye.
Okay.
And so with your right eye, I want you to tell me what line you can read, the smallest letters you can read.
Okay. GLQZRF.
Good. And get you to switch eyes there. And again.
GLQZRF.
Good. And you can't read any letters smaller than that?
No, that's the most I can do.
Okay. So it looks like you are at, that is the 20/20 vision line. So you can see at 20 feet what most people can see at 20 feet. So excellent.
Sweet. Cool.
Good. So you can have a seat there. The next set of tests we'll do are your cranial nerve exams.
Okay.
And so there's 12 of them. So the first cranial nerve, we're going to test your smell. And so what I want you to do is I want you to close your eyes. You're going to block one nostril with your finger, and then you're going to tell me when you can smell the soap,
Okay.
the hand sanitizer here.
Yep.
Good. And I'll get you to block the other one.
Yep.
Good. And we're going to check your optic nerve. So I'm just going to check your pupils. Okay. So look at me in the forehead. And you're just going to see some light. Good. Excellent. The next test we're going to do is the diagnostic positions test. This is going to test 3, 4, and 6.
Okay.
So what I'd like you to do is follow the tip of my finger with your eyes. Excellent. That all looked good. The next one is cranial nerve number 5. So what I'm going to do is I'm going to kind of tickle different parts of your face with this paper towel here. And I'd like you to tell me where you feel the sensation. It'll either be forehead, cheek, or chin. All right?
Forehead.
Good.
Cheek. Chin. Cheek. Forehead. Chin.
Good. So the next one we're going to test is number 7. So I'd like you to raise and lower your eyebrows like this. Good. And you're going to puff your cheeks. Excellent. And give me a big smile. Excellent. Great job.
Awesome.
All right. The next one we're going to do is for cranial nerve number 8. And we're going to do the whisper test. So what's going to happen is you are going to intermittently kind of push your tragus here, this little fella, in and out.
Okay.
And I'm going to whisper into your other ear, and you're
Okay.
going to tell me the word that I whisper to you. Okay? So we'll start there.
Cucumber.
Excellent. And then the next one.
Asparagus?
Excellent. All right, number 9 is going to be the ah test. So I'd like you just to say ah like that. Good. And now I've got this sterile tongue depressor here, and we're going to do the gag reflex test. So I'm just going to touch the back of your tongue with it and check to see if you have a gag reflex. Okay. Good. And then we're going to skip to number 12, and I'd like you to stick your tongue out, move it to the left, right, up, and down. Perfect. And lastly, number 11, if you could shrug your shoulders for me, just like that. Perfect. Excellent job. So that's your cranial nerve exam, all done.
Okay.
So now we're going to move to the head to toe. So we're going to start, for a lot of this, I'm going to look just to see if I see any abnormalities. I'm going to palpate, and then in other areas I'll percuss, do some tapping on different sections, and then some palpation as well, okay?
Okay.
Good. So check out your scalp here. Good. And let me know if there's any pain when I do this. This and down. Any pain there?
No, nothing.
No? Do you ever get headaches or dizziness?
No, not usually.
No? Good. Okay, now for your face. Any pain here? Down here? No?
No.
Gonna check your sinuses.
Okay.
So press just above your eyebrows. And then your cheeks here. Good. And then can you open your jaw nice and wide? Good. And close it. And open again. Excellent. Good. So now we're going to check your eyes. So we checked your pupils and they were reacting well. Just looking, don't see any problems. Do you wear contacts or?
No.
Okay. So I'm going to check the sclera. I'm just going to pull your eyelids down here. And just check the color and consistency here. Good. And now we're going to do what's called a confrontation test.
Okay.
So what I'm going to get you to do is cover one eye with this card. Good. And this is going to check your peripheral vision. So we're going to do the same thing. You're going to tell me when you can see my finger. Okay. So it'll be coming at different angles. Okay. So let me know when you can see my finger.
Yeah.
Good.
Yeah.
Good.
Yeah.
Good. And we'll switch eyes.
Yeah.
Good.
Yeah. Yeah.
Good. So yeah, we were about 60 centimeters away from each other, and I was comparing my peripheral vision with yours,
Okay.
and everything was looking good there as well.
Sweet.
Okay, next is going to be your nose. Do you ever have nosebleeds or any problems with your nose at all?
No.
No? Okay.
No.
So, any broken nose ever?
No.
No? Okay, yeah, looks good. And any pain when I press here or here?
No.
No? Good. Next, we'll check your mouth. Any pain with the tongue, teeth, cheeks, anything like that?
No.
No?
Nothing.
Okay. So I'll get you to open wide again and say, ah. Good. So I can also see your tonsils there, and they look like they are graded at a 1 positive.
Okay.
And so that means that there's no swelling, that they're all looking good.
Sweet.
Yeah.
Good to know.
Next, we're going to check out kind of your neck area and jawline.
Okay.
And so, can you swallow for me? Good. Any problems with sore throat or anything right now?
No.
Okay, I'm just going to check your lymph nodes. So start here, move to the back, and then underneath as well. Good, I don't feel any swelling there. No pain or any pain at all?
No.
No? Okay, the next thing we're going to check your thyroid gland for any enlargement. So this is going to feel a little weird. I'm going to essentially move your throat from side to side and ask you to swallow. Okay? So we'll move it, my thumbs, and swallow. Good. And over, and swallow. Good. Feels kind of weird, hey?
That's super weird.
Yeah. All right. The next thing I'm going to do is auscultate your carotid artery here. So I'm just going to find it. Good. Right there. Good. So I'm listening for something called bruits.
Okay.
And bruits in here is going to sound like sound like a whooshing sound.
Yeah.
And so that's from any obstruction or any impedance of flow.
Okay.
So I'll let you know if I hear any of that.
All right.
Good. I'm going to check 3 spots along the line. Good. Sounds good. On this side. Okay. Good. So that all looks good.
Okay.
All right, now I'm going to get you to take your shirt off, and you can put it just on the bed here. Good. And now, I'm just going to move the chair a little bit, and I'm going to get you to sit facing this way. And I'm just going to check the upper part of your back first. So can you take a nice deep breath for me? Good, that appears to be symmetrical. What I'll do to check that is pinch a fold of your skin here, about T9, and ask you to take another breath. Good. So my fingers separated at the same time, meaning there was some good symmetry there.
Okay.
Yeah, so the next, I'm gonna do some palpation here. So what I'm gonna get you to do is we're gonna do a test called the tactical fremitus test.
Yeah.
And what it's gonna do is, when you say, when you speak, there's vibrations that go through your bronchial tree,
Yep.
and you can actually feel it if I put my palm on different parts of your back here.
Okay.
So there's a certain phrase that gives it a better vibration, and it's 99. So what I'm going to do is I'm going to get you to say 99 10 different times. I'm just going to feel different parts of your back. Okay?
All
So
right.
when I move my hand, you can say it, and then I'll move it again, and you can say it. All right?
Okay.
All right.
99,
Perfect.
99, 99, 99, 99, 99, 99, 99, 99, 99.
Excellent. That was 10. Good job.
Awesome.
All right. So now I'm just going to have a listen to your lungs here. Use the bell on my stethoscope. And so what I want you to do, have you had a physical before?
Yeah.
Yeah, so sometimes I know for me, I've gone for a physical and I feel like I have to breathe like, and I start to get a little bit lightheaded. I'm not sure if you've ever had that
Yeah,
before.
yeah,
You're like, oh man. So what I want you to do is just, you can breathe in a little bit deeper than normal.
Okay.
We're gonna keep a good rate so that if you do start feeling lightheaded though,
Yeah.
let me know and we'll just take a break and then we'll continue on. Okay?
Sounds good. Yep.
Okay. Okay, go ahead. Good. Good. Just go at your own pace, okay? Excellent. So your lungs sound clear.
Sweet.
I'm going to do some percussion now, so you're going to feel some tapping on your back.
Okay.
Alrighty, and now I'll get you to turn around on the chair here. Face forward. Good. And take another big deep breath in for me. Good. Any pain at all when you do that?
No.
Have you had a cough? Any breathing problems?
No.
No? Okay. So I'm going to do that same thing I did on the back, just to check for equal expansion when you breathe in.
Okay.
So I'm just going to put my thumbs at your xiphoid process here, and take a deep breath. And out. Good. Good job. We're going to have a listen again to your lungs here. This will be just in 10 spots. Sorry, let's do it here. There we go. There we go. That's fine. Two more. Good. Good job. Now we're going to do, again, some percussion here, some spots. Good. Great job. Alrighty. Now I'm going to get you to put your shirt back on. So I can do this. And while we're sitting here, before I get you to lie down on the bed,
Yep.
I'm going to check out just your upper extremities.
Okay.
So, do you have any joint pain, shoulder, elbow, wrist?
No.
No?
No.
Any other numbness, tingling sensations?
No.
No? Okay. So what I'm going to do first is feel your pulses. Okay. Just turn this thing just a little bit there. Okay. Good. Those are strong, equal bilaterally. And you can have a stand here. So we're going to check some range of motion. So what I want you to do is you're going to put your arms out wide,
Okay.
and then you're going to put them behind your back, just like this.
Okay.
Good. And now same thing, out wide, and then you're going to put them over your head. Like that. Good. Great job. And now we're going to test your strength here.
Okay.
And so I'm just going to hold here, and then I'm going to hold your wrist. And what I want you to do is just do a bicep curl. Okay, strength is okay in that arm. I'm just kidding, it's good. Okay, and again. Great job. You're a little bit stronger than I am.
Perfect.
All right, so I'm just gonna move these chairs out of the way here. Right. And so what I get you to do is lie down on the hospital bed here.
Okay.
And so lie down as flat as you can go. I know there's kind of a permanent cushion here. Good. Alrighty. So we're just gonna check your neck vessels here. Doesn't appear to be any jugular vein distension. You can turn your head to the left and right. Excellent. Okay. Now I'm gonna get you to take your shirt off, and we'll check your chest line down. So I'm gonna feel here for a palpable thrill. And now I'm gonna check for your apical impulse. So what I'm gonna get you to do is you're gonna exhale, and then I'd like you to hold that exhale for about 3 seconds, and I'm just gonna be feeling on your chest here, okay? Right at kind of where your left ventricle is.
Okay.
All right, and out. so that feels good as well. I'm gonna have a listen to your heart sounds. So what I'm gonna do for kind of those normal heart sounds, I'm gonna listen to the diaphragm of my stethoscope. And then I'll flip it over, listen with the bell, see if I can hear any heart murmurs or any abnormal sounds. What we used to do is we used to listen at S1, at the second intercostal space, here and here, and then the fifth intercostal space. I don't know if you remember that from the old textbooks, but there's a little bit more of kind of a vague way to listen now, which is what I'll be doing.
Okay.
Good. So you have a strong equal S1, S2, which is that lub dub sound.
Okay.
So now we'll listen to the other sound here. Great. All right, so we're going to move on to your abdomen now. So, like we said before, normally what I've done is I've inspected, and then we've done some palpation, then percussion, and then auscultation. So the abdomen's a little bit different. Looking for any abnormalities, any pulsating masses, anything, surgical scars. And it doesn't look like you have any of that going on. And then what we do is auscultate next, because if we palpate, it's actually going to change some of the sounds of your of the organs when I auscultate here. So we'll do that first. So we're just listening for vowel sounds. Good. So those are all, that's a normal amount. Now we're going to do some percussion. I don't know if you can hear that. Can you hear the different,
Yeah, I was gonna say,
sounds there? It's kind of dull,
there.
dull up here.
Yeah.
Good. All right, so now I'm going to do some light palpation. And what I'm going to do is I'm just going to put this blanket under your knees here, and it's just going to do a little bit of support. Good. So just what I'm going to do first, light palpation is going to be no more than 1 centimeter. Okay. Any pain or discomfort there?
No.
No? Okay, so we'll go a little bit deeper. Again, let me know. This is going to be about 5 to 8 centimeters. What we're shooting for. Good. Any abnormalities, pain, anything there?
No, nothing like that. No.
Good. And you said you went to the washroom before.
Yeah.
So no problems with that.
Nothing.
Good.
No issue.
one thing I'm going to do now, which maybe a test you haven't seen before, it's called the hook test.
Okay.
So I'm going to be feeling for your liver if there's any inflammation or any pain that's going on there.
Okay.
So I'm going to stand up by your shoulder, and I'm going to hook kind of my fingers just under your rib cage a bit.
Yeah.
And then I'm going to get you to take a big deep breath. So what that's going to do is when you breathe in, your diaphragm goes down.
Yeah.
It's actually going to move the liver down just a little bit. So see if we can have a good feel of it here. Okay, so I'm going to hook here. You can take a big breath. Good. Right there. And out. Good. How was that?
Good. No.
No pain, nothing?
No.
Excellent. Alrighty, I'll get you to put your shirt back on. And you can stay lying down. There you go. Figure that one out. And I'll take this blanket here from you. And once you get the shirt on, I'll get you to take your socks off.
Okay.
Excellent. Alright, so kind of same questions with your arms there. Do you have any joint pain, knee problems, ankle, anything like that?
No, nothing.
Numbness, tingling,
Nope.
any abnormal sensations? No?
No.
Alrighty. So, yep, they look okay. No edema, nothing abnormal. Just gonna feel your pulses here. So your dorsalis pedis. Good. So those are strong and equal bilaterally. Now I'm not sure. Yeah, we can do this. So what I'm going to do is I'm going to put some pressure at the top of your feet, and you're going to do toes to your nose.
Okay.
All right. So go ahead. Good. And then you're going to push down. Good. So that was dorsiflexion and plantarflexion
Okay.
that way. We're going to test some strength with your right leg, kind of all the way up to your hip. So what I'm going to do, same kind of thing. We're going to put some pressure just against the top of your leg, and I'd like you with a straight leg to lift it up in the air.
Okay.
Okay. So go ahead. Excellent. And same here. Good. All right. And now with no pressure against it, if you could lift with a straight leg right up in the air to 90 degrees with your right. Good. All the way and down. And with your other leg. Excellent. Okay, and now if you could flex at your knee, and then I'm going to get you to internally rotate with your right leg. So flex at the knee and internally rotate. Good. And now, yep, and then yep, flex again, and then externally rotate, and then straighten your leg and down. Good. And we're going to do the same thing with this leg. So first we're going to flex. Flex at the knee now.
Oh, flex.
Yep, that's good. And now internally rotate. Good. And down. And then up again. Flex. Externally rotate. And down. Excellent. Alright, the last test we're going to do here, we're going to test your spinal thalamic tract.
Okay.
So I've got this tool here. It has a sharper end and a duller end.
Okay.
I'm going to press on different parts of your feet at different intervals just to throw you off a little bit.
All right.
And you tell me if you feel dull or sharp.
Okay.
Okay?
Dull. Good. Sharp. Dull. Dull. Sharp.
Good. And we'll do it with the other foot.
Sharp. Dull. Dull. Sharp. Sharp.
Great job. Alrighty, you can have a stand up now. You can put your socks on here if you like.
Sure.
There you go.
Stand up, you said?
Yeah, you can stand up. And the last section of test here we're going to do is some balance and coordination.
Okay.
So what I'd like to get you to do, you've got your feet shoulder width apart, And now if you can close your eyes, I'm going to apply pressure to either your left or right shoulder.
Okay.
And we're going to see how your balance is doing today. Good. Alright, so the next one we're going to do, you've probably seen this, a couple of these tests on cops while they
Okay.
pull people over.
Yeah.
So I'm going to get you to walk just to the end of the carpet here, and with one foot in front of the other, just like that.
Okay.
Go ahead. Excellent job. And you come back here. And now we're going to do, you're going to put your heel to your knee, just like that. Good. And the other side. Good. And now you're going to touch your thumb to your index finger, middle, ring, pinky. So you're going to do that twice. Excellent. And the last one, this is a classic one, you're going to touch your nose. So straight out and touch your nose just like that.
Okay.
Great job. All right. We're all done.
Sweet.
Is there, just kind of looking back on the exam here, was there any pain or anything that you're kind of thinking back on that maybe came up or anything abnormal?
No, everything felt pretty normal.
Good. Any questions or concerns before we finish up here?
No, I think that everything's good.
Good. So you got your driver's license
Yep.
that we're going to be doing this for.
Yep.
So I'll write up all the documentation. It'll just note everything that I saw, everything that was good.
Okay.
And yeah, and then we'll send that to you and you can get that done.
Sweet.
All right. Anything else?
I think that's it.
Excellent. Well, it's great meeting you.
Yeah.